Hello, my name is Brianna Garcia, and today I will be presenting on congenital syphilis and its impact on Maricopa County, located in Arizona. Syphilis is a sexually transmitted disease. It typically starts off as a painless sore, which spreads to other areas of the body, including hands, genitals, and mouth. Left untreated, the disease can be life-threatening. Pregnant mothers can pass it on to their unborn infants. Infants born to women with syphilis are at risk for infection while in utero or during the delivery. Infants can also be born premature, stillborn, or pass away after birth. Signs and symptoms include skin rashes, deafness, teeth deformity, saddle nose, and blindness, just to name a few. The rate of syphilis seen in pregnant women has significantly increased in Arizona due to lack of prenatal care or infection during the pregnancy. In 2017, 321 infants were born with congenital syphilis. This graph depicts the incidence of congenital syphilis in Maricopa County. According to the Maricopa County Department of Public Health, cases of genital syphilis nearly tripled with 50% increase from 2017 to 2018 alone. Between 2016 and 2018, the proportion of syphilis cases among females rose from 17% to 25%. According to the CDC, in 2018 there were a total of 1,306 reported cases of congenital syphilis, including 78 syphilic stillbirths and 16 infant deaths, with a national rate of 33.1 cases per 1,000 live births. The increase of syphilis seen in infants is partially as a result of the increase of STDs seen in women. An issue could be due to lack of prenatal care and testing for STDs during the pregnancy. Fortunately, congenital syphilis is preventable and can be treated with antibiotics. In the next slides, I will discuss some examples of prevention strategies which could help reduce the prevalence of congenital syphilis at the 3 levels of public health intervention. An example of primary prevention would be just talking with a medical provider. Women first need to talk with a medical provider and inquire about getting tested for syphilis. They should discuss their sexual history and their risk for getting syphilis, along with the health risks associated with congenital syphilis. An example of secondary prevention would be testing. Women should get tested for syphilis at their first prenatal visit, additionally at their 3rd trimester visit, and delivery if they are at high risk. Finally, an example of a tertiary prevention is treatment. If the test result returns positive, the next step is treatment. Work with the medical provider to get the appropriate treatment for yourself and partner. The Maricopa County Department of Public Health and the Arizona Department of Health Services website strongly advises high-priority syphilis testing and treatment guidelines for women of childbearing age. Additionally, Arizona law requires syphilis testing during the first prenatal visit or first medical visit. This could include at an urgent care or emergency department setting. Next, I will discuss a published article review concerning congenital syphilis prevention in Kern County, California. The purpose of the study was to evaluate the structural barriers to prenatal care access, which increase the risk of congenital syphilis in pregnant women. A total of 42 pregnant women or newly pregnant women participated in the study and completed 5 focus group discussions. 8 in-depth interviews were conducted by 8 medical providers in the prenatal care field. Data was collected between September 2018 through January 2019. In addition, the woman needed to be 18 years or older and at high risk. Of the 42 pregnant and postpartum participants, 9 were recruited from a local residential rehab program, 10 from a non-residential rehab program, 8 from transitional living communities for those with substance use disorders, and 5 from domestic violence and sexual assault organizations, including 10 from the greater community in Kern County. The following are a few examples of the responses from the participants to the questions that they were asked about STDs. Through the use of descriptive qualitative analysis interviews, the researchers found that Poverty, substance use, citizenship status, lack of health care, low sexual health literacy, and gender inequality may interfere with recommended care during pregnancy. This could delay identification and treatment of congenital syphilis. The study goes on to state reinvesting in public health departments, engaging providers in screening and surveillance guidelines, and creating wraparound services that link prenatal care with programs that serve vulnerable women will be important to reduce congenital syphilis cases attributable to healthcare provider missed opportunities. The battle against congenital syphilis is far from over. Through the development of standard sexual education programs, frequent prenatal care visits, and accessibility to syphilis tests, more can be done to prevent upsurges of the disease. These are my references.